Okay, this is anybody who's suffered a whiplash injury, that has had long-term severe symptoms, that have been told they're suffering WAD or WAD, which means basically waiver diagnosis, not whiplash associated disorder, because that doesn't mean anything. Whiplash associated disorder, well, there is actually now an upright MRI scanner that can scan the craniocervical junction and find out exactly just what your injuries are that you've succumbed to during your whiplash and head injury. I went to see an NHS neurosurgeon yesterday, who I tried to educate about the gentleman who introduced the MRI scanners to the NHS donkeys years ago, a gentleman called Professor Francis Smith. He's been working for over 30 years in diagnostic testing with MRI scanners. He did introduce the supine one where you lie on your back, but this is not adequate enough to show the injuries that can happen when you have a severe whiplash injury. Basically, it doesn't look at the craniocervical junction. The new scanning machines are upright machines, and they'll show your body with relation to gravity, and the more they define things more, and they look at your head and neck when in movement, in forward flexion when it's normal, and extension, and also rotation. And you will get a written report at the end of that. The only problem is the NHS neurosurgeons don't take any notice of the written report. So even though this professor has introduced the first MRI supine scanners, they are now ignoring his call to image people in the upright position. There is quite an important video on YouTube that I think that anybody's interested that wants to find some answers should look at this video. And it's, if you put in Professor Francis Smith, Francis Smith, you will find it's one that's been done last November 2017, and it's at Skeins University, and it's about whiplash and the craniocervical syndrome. Okay, thanks.